Hi, I'm Dr. Michelle with Treble Health, and today I'm going to be discussing exploding head syndrome. Exploding head syndrome is a parasomnia, or an undesirable event that occurs while we're sleeping, where we hear a loud crashing sound, cymbals, any kind of sensation of loud sound while we're either falling asleep or suddenly in the middle of the night. Some people report that the sounds that they hear are like that of a loud bang, an exploding bomb, or a clashing of cymbals. But in essence, it's just a very loud sound that wakens you while you're either about to fall asleep or already asleep. Individuals may also experience muscle jerks or myoclonus movements, as well as flashing lights. And sometimes these episodes can occur frequently in the same night or periodically throughout various nights. Sometimes individuals will report that they haven't had any episodes for several months and then they return again. So the frequency of the exploding head syndrome varies greatly from person to person. Although the name exploding head syndrome sounds as if it would be really painful, in fact, it doesn't cause any pain. Most people do not report any sensations of pain following any of these episodes. Some people will feel some sort of pain or sensation in their head while they're having an episode of exploding head syndrome, but again, most often than not, it is a painless disorder. So how common is exploding head syndrome? Fortunately, it's not that common. It's a rare sleep disorder. It tends to affect females a little bit more than males, and it can happen across all ages. So other than that, there aren't any other trends in regards to who is more susceptible to experience exploding head syndrome. As I mentioned before, the frequency of exploding head syndrome episodes vary greatly from individual to individual. So some will experience many episodes within one single night. Others may experience just one single episode over the course of several nights, and then they may go for days, weeks, months without having experienced one single episode. So what factors bring about exploding head syndrome? There aren't any clear factors that have been identified, but it's thought that maybe feeling extremely stressed or extremely tired may be more linked to experiencing these types of episodes at night. But other than that, there haven't been any clear factors that have been identified as causing exploding head syndrome. While we don't know the exact cause for exploding head syndrome, there are some theories and ideas as to why this happens in some individuals. One is an increase in activity of the brain's sensory cells. Another possible cause is damage or dysfunction of the inner ear. Other individuals feel that it's part of the aura that occurs before a migraine. Another possible cause is abnormal attention processing that occurs between the sleep-wake transition. And others believe that it might be a side effect of taking some medications like SSRIs, selective serotonin reuptake inhibitors, or benzodiazepines. So a common question is then, how long do these exploding head syndrome episodes last for, and are they harmful to your overall health? Luckily, the episodes last less than a second, and they have not been found to affect one's health. Of course, it can cause feelings of distress and upset and may make it harder for one to be able to fall back to sleep, but outside of those factors, it doesn't have any implications on overall health or well-being.
This is a short break from today's video to announce the Tinnitus Guide by Treble Health. Do you want to learn about the newest tinnitus treatments and management tips? Click the link in the description of this video to get your free copy of the Tinnitus Guide by Treble Health.
So how is exploding head syndrome diagnosed? The first step is to see a sleep specialist. This physician will determine whether or not what you're experiencing falls under the criteria of the International Sleep Disorder Classification of exploding head syndrome. The criteria include waking up suddenly to a loud sound or explosion, feeling frightened or stressed or anxious after this episode, as well as not experiencing any pain. If you meet these criteria, then your sleep specialist is likely to diagnose you with exploding head syndrome. But they may also recommend that you have other sleep studies conducted just to determine that it's not something else. So some of these tests include a polysomnogram, an EEG or electroencephalogram, as well as an MRI, magnetic resonance imaging. A polysomnogram measures brain and body activity while you sleep. So it will take measurements of your heart rate, eye movement, breathing, and brain waves. An electroencephalogram, or EEG, measures the electrical activity of your brain while you sleep, and it's usually a way to rule out that you're experiencing nocturnal epilepsy or seizures while you're sleeping. Lastly, an MRI, or magnetic resonance imaging test, checks the actual structures of your brain for any abnormalities. Your physician will also evaluate whether or not you have a family history of sleep disorders or any kind of mental or psychiatric illnesses that may be contributing to these symptoms. So how is exploding head syndrome managed? There isn't any formal treatment for exploding head syndrome, but it's important to see a sleep specialist so that they can help rule out anything else that may be contributing to your symptoms, as well as to give you the sense of confidence that there's nothing more significant going on and that what you are experiencing is completely benign. There currently aren't any medications that are meant to treat exploding head syndrome, so you're unlikely to receive a prescription from your medical provider, but they may prescribe something else related to another condition or symptom that you're experiencing. How to prevent exploding head syndrome? There isn't any way to specifically prevent exploding head syndrome. It's something that just occurs sporadically and randomly from individuals. Sometimes there are certain triggers that they can identify as causing more frequent episodes of exploding head syndrome, like stress or lack of sleep. But other than that, there aren't any specific things that you can do or not do in order to avoid experiencing exploding head syndrome. But if you are experiencing these symptoms, it may be worthwhile to start doing a sleep diary to assess whether or not there are certain triggers or patterns to your episodes, and then you might figure out whether or not you need to maybe go to sleep earlier, go to sleep later, exercise, because again, everybody's different and everybody's body reacts differently to all the different things that we do on a regular basis. So you might be able to find a pattern to your episodes. So to sum up, while exploding head syndrome can be something frightening and scary, it's not in terms of what it means to your overall health. It's not because of a brain tumor or because you're experiencing a stroke, but it is just a rare sleep disorder that happens for some individuals, and in most cases it does resolve over time. But if you are experiencing these symptoms, it is worthwhile to visit a sleep specialist to try to figure out if there's anything else behind these sudden episodes of loud sounds that are either occurring as you're falling asleep or in the middle of the night. Hope you found this information helpful. If you did, please comment below. And if you haven't already subscribed to our channel, please hit the subscribe button to keep up to date with all of our latest videos. Thank you so much.
Thank you for watching today's video with Treble Health. Check out our next video by clicking the button on this screen or another recommended video. And if you're not already, make sure to subscribe to our YouTube channel. Thanks so much. See you on the next video.